Welcome to our podcast. How are you sleeping these days? Sleep is our refuge. It's our renewal. It's the rest that's essential to life and health. And now COVID-19 has us worried. We're concerned and distracted for so many reasons. And as we all know, that can affect our slumber. I'm Maureen Merrill. I'm host of our podcast, sponsored by Dr. Anish Shah, psychiatrist and director of Siyan Clinic in Santa Rosa. And today, our special guest is Dr. Setu Vora. He's a sleep expert, and we're going to talk with him and with Dr. Shah about your sleep, some questions about the current crisis and its effect on our slumber, and what we can do, well, to get a good night's sleep. I'm going to ask Dr. Vora and Dr. Shah to introduce themselves to us, please. Dr. Vora?
Hello, Maureen. Hello, Dr. Shah, Anish. It's a pleasure being with both of you. I'm on the East Coast, Connecticut. It's about 5:30 and it's a beautiful evening. It's a wonderful time to spend with you learning more about the COVID pandemic and its role, impact on all of us, especially sleep, as you mentioned. So, by background, I know Anish, Dr. Shah, for many, many years. We trained together in medical school, and our journeys have brought us to US with my specialty training in lung diseases, critical care, and sleep medicine. And I'm here in Connecticut serving as a chief medical officer for a local tribal nation.
Great. Thanks, Dr. Vora. Dr. Shah.
Thank you, Maureen. And first of all, great to see you, Setu, and connecting with him after many, many years.
Many years.
He was our senior in our medical school, an ideal for many. And I have tracked him over the years, doing a lot of the public health work. And I thought about sleep and COVID-19, and I could not think of anybody else but Setu to come on our podcast. And he graciously agreed to come. So, Setu, great to connect with you. Just so a little bit about my background, I'm a psychiatrist. I'm also a researcher and a medical legal evaluator. I'm here in Santa Rosa. And I'm also CEO for Siyan Clinical Corporation. And with this COVID-19, which is reeling all of us, we have been looking to contribute to our community with some educational and informational videos and audio podcast. And good to have you, Setu, here in our podcast.
My pleasure. Thank you for having me.
Yeah.
Well, let's jump right in. Dr. Vora, what are some of the sleep issues that you're noticing in your practice, especially now? And what special issues are driving this?
Certainly. I think the overarching theme is that the coronavirus pandemic is causing corrosive anxiety. I think all of us would agree that the fear of unknown, the risk of, acquiring the infection personally, or worry about elderly loved ones, all those physical, health issues are looming heavy on people's minds.
Mm-hmm.
Besides that, of course, the double whammy of oftentimes being out of work or unemployed due to the COVID pandemic adds the financial stress on top of it. So what I'm seeing in my clinical practice and also at the population health level is that sleep takes a hit. And there are other reasons besides stress as well, but I think that's the prime driver affecting sleep.
Yeah. I think it's probably everybody's deep desire right now to have a public health doctor to talk directly to. And second only to that, of course, to ask about sleep. But just kind of a basic question. Maybe I'm not clear, many others may not understand. Why is sleep so important in general?
Yeah.
And why now? What problems come up when we don't get it? And what is it about the human animal that needs it so much?
Certainly. I think, throughout evolution, sleep is a well-preserved function, as we all know it. If sleep did not have a good biological functional role, then God made a big mistake in, designating us to be unconscious or semi-conscious for at least 1/3 of our life. So it clearly has a powerful role in restoration of health, rejuvenation of bodily functions. We know it has tremendous role in its circadian rhythm, meaning the biological clock of life. And it regulates the rhythm, the symphony of the hormones, and it regulates the functions of different organ systems. When we don't have sleep, then we notice all the deficiencies that pop up. And when we have nice, easy sleep, we take it for granted.
Yeah. Yeah, we may not know all the reasons, but we certainly know how it feels. And Dr. Shah, there's so much anxiety throughout our community in this whole pandemic. What psychological issues have you noticed in particular that's come up now?
It's a good question, Maureen, and we can all imagine that mental health and psychiatric issues are at rise with current COVID-19 pandemic, and that's what we have been seeing in and out in our practice more recently. I think the growing unemployment and also the unknown that is related to COVID-19 pandemics in terms of outbreaks, not having availability of vaccines or the treatment modalities, and also the fact that we don't know where we are leading or heading to, and that is causing a lot of the anxiety and clinical issues in our patient population. So we have been seeing more increase in anxiety, clinical depression. I've had also patients report increase in alcohol, cannabis use, and opiate use. So really the COVID-19 has got us reeling with mental health aspects as well now.
Yes, I can imagine.
Yeah.
Did you want to say something, Dr. Vora?
No, I think it's standard where when many of us have a predisposition, right, then the pandemic almost acts like the precipitating factor to really increase the underlying conditions that we all may have to begin with.
Right.
Or if it was subclinical, now it becomes even more obvious.
Mm-hmm. So people who already have, I'm sorry?
Absolutely, no.
Okay. It's if people or your patients already have sleep apnea or other recognized sleep disorder, does this whole epidemic make it worse, or does it just make more people have those symptoms?
Yeah, no, I think it certainly has the potential of making sleep disorders more acute and worse. For example, because of the heightened stress and anxiety and comorbid depression that goes along with this, what we are seeing is that people don't have the same structure and the routine, the rhythm of life. Oftentimes there's work from home option for some who can, and there's no get up and go left, right? So oftentimes what happens is we have noticed many people report increased screen time, especially in the evening and late into night. And what happens is it just compresses your sleep duration. So it leads to a tendency towards either fear of missing out, scrolling the news on screen, small screen, or binging on Netflix or Hulu or whatever channels you subscribe to. But all that leads to a hyperarousal state. And the stimulation from all these sensory input, especially over a long period of time in the evening, just before bedtime, certainly makes the insomnia worse, sleep onset insomnia, and especially also sleep maintenance insomnia. There are two types of insomnia. Different falling asleep or staying asleep. But I think even more prevalent is the condition of this new sleep deprivation. People are just not getting enough sleep. And that leads to increased fatigue, anxiety in the daytime, reduced cognitive function, the clarity of thinking is lower. People are more irritable when we don't have sleep. And Maureen, it's interesting. You would think that sleep, is a passive phenomenon. But those of us who have the experience of being on call overnight, we know that when we are staying up late, our body craves comfort food. It easily gravitates towards simple sugars, carbohydrates, and that's because of the nice balance of two hormones. The two hormones that I would urge your listeners to look up are the ghastly ghrelin and the lovely leptin. So what happens is when there is sleep deprivation, the ghastly ghrelin goes up, and it makes you feel hungry. And the energy and hunger metabolism is more directed towards finding whatever is there, a bag of chips, or box of pretzel, a whole tub of ice cream if you're staying up late. And that can also then induce other issues with increasing weight gain, increased acid reflux, loss of impulse control, especially when you're faced with a pandemic and it's all doom and gloom. People don't have the same discipline of planning for the future. Mm-hmm. And I often see many of my patients live life as if this is the last day. And that's why what Dr. Shah mentioned, increased use of substances, including alcohol. And let's face it, you are in Napa and beautiful Sonoma area. The wines are amazing, right? But in moderation. What happens is when people are faced with uncertain future, they are more likely to take more risk. And we know that alcohol is a strong muscle relaxant. So what happens with that now? The upper airway muscles become more relaxed. So if someone has snoring or sleep apnea, it certainly gets even more exacerbated, more worse, severe. Now, alcohol may allow people to fall asleep rather easily, but the metabolism of alcohol results in sleep disruption. And we know that it does not allow people to go into REM as much. And so, similar to sex, where alcohol may increase it the desire, but take it away the performance, same holds true for sleep. It may help people fall asleep, but their sleep duration, the sleep quality is very fragmented. So certainly, there are a lot of effects on sleep disorders throughout the pandemic.
Are you speaking of moderate use as well as any use at all, or just moderate use?
I think a lot of research is suggesting that even the previously advocated moderate use does have deleterious effect on health, especially the signal around increased risk of cancers. But let's not be killjoy. Let's say life is life and life must go on. What I would suggest is for women to limit themselves to one standard drink, and for men no more than two. And I would certainly recommend not to consume those wonderful beverages at least 2-3 hours before bedtime. So earlier in the evening, the better.
All right. Sounds like good advice in any case, huh?
Certainly.
Yeah. Just switching a little bit, there's been some talk about ventilators and whether they're helpful or not with sleep or with other symptoms and disturbances. What is your perspective on that?
Yeah, so Maureen, when we say ventilators, typically we mean intensive care unit type ventilators, right? So patients with COVID-19 do end up with respiratory failure. We know that. And oftentimes we try to correct that with use of supplemental oxygen delivered by the nasal cannula or with a non-rebreather mask. But when the condition is more severe and they're not able to maintain their oxygen level and they're getting very tired, increasing work of breathing, then to help support their life, we intubate them. And what we mean by intubate them is to put a tube, plastic tube, down the throat into the trachea, the windpipe, and connect that to a mechanical ventilator that delivers the air, mainly with the oxygen, into the lungs and supports the lung function that way. So it is a life-saving device. It is certainly used in patients with ARDS, or acute respiratory distress syndrome, that we see even with COVID-19. We certainly see it with regular influenza or pneumonia as well. So it's not unique to COVID-19. So it is a lifesaver. Having said that, there are non-invasive ventilators as well. Many of our patients who have overlap condition, meaning that they also have severe COPD, emphysema, or they may even have some neuromuscular disease, such as Lou Gehrig's disease, where their respiratory muscles are weak and they are not able to clear out the carbon dioxide, CO2. Then they need the non-invasive ventilator at home. We call it BiPAP, or bi-level ventilation. It's a type of non-invasive ventilator where you don't have to stick the tube down the throat. You just have a mask on the face and it delivers positive pressure air to help the lungs expand and reduce, so that you can exhale the carbon dioxide and inhale the oxygen in. Certainly a useful device.
Okay. I really appreciate how you're explaining the medical terms so that non-medical people can relate and understand what you're saying. And along those lines, I came across a question about, I think I would say a CPAP or CPAP machine. I realized I actually don't know what it is, but a question came up about how that, should patients continue to use it if they have COVID and so on? What's the relationship there? And could you tell me what it is?
Sure. I'm glad you asked that. It's a really vital question, because we know that upwards of 10% of the US population may have undiagnosed or diagnosed obstructive sleep apnea.
Oh.
What we mean by obstructive sleep apnea is that when we sleep, there's a collapse of the upper airway and the airflow to the lung is reduced significantly. So the body tries to breathe, but there's no flow going into the lung because of the blockage up in the throat. And that's known as obstructive sleep apnea. Apnea meaning literally reduced or no breathing. And that's a common condition, frequently underdiagnosed. And patients who have that condition can often be treated easily with a device known as CPAP that you mentioned, Maureen. And the CPAP stands for continuous positive air pressure, right? It's a simple device of a mask with a compressor that generates the air under pressure and gently delivers the pressure into the throat. The air acts like a stent. It keeps the airway open and does not allow the throat to close up. So there's no more vibration of the throat. So there's no more snoring sound. The spouses love the treatment even more than the patients do, because finally they can sleep. There's peace and quiet harmony.
Yes.
Husbands are allowed back into the bedroom after many years of being kicked out to the doghouse. So it's a life-saving device for men and for marriages.
Relationship saving, huh?
Yeah.
Certainly. Having said that, women also have sleep apnea. And the risk of having obstructive sleep apnea goes up significantly following menopause. And so we know that there is a hormonal protection that can be lost with menopause. The cardinal symptoms
apnea, does that mean, I'm sorry.
No, go ahead.
Apnea means interruption. It almost sounds like it has to do with snoring.
Correct. So the classic patient with sleep apnea may have a crescendo of snoring where they, and then there's a pause in breathing, and then they break the cycle, take a gasp of air, and reset the breathing cycle, and it keeps happening throughout the night. With each obstruction, you could imagine the oxygen level goes down. Brain gets the signal to wake up. SOS, wake up, mayday. So there's a lot of micro arousals of the brain level. So even though you may spend 8 hours in bed, the sleep is disrupted. So the brain feels deprived the next day. So patients with sleep apnea are tired. They don't have the motivation to exercise because they are not getting enough sleep. Their blood pressure is up. They have a higher risk of type 2 diabetes, increased risk of stroke, atrial fibrillation, which is the irregular rapid heartbeat. And that's all treated by significant weight loss, using nutritional plans, judicious exercise programs, avoiding alcohol, and certainly using either CPAP, which is the continuous positive air pressure, or for those patients who are unable to use CPAP because of claustrophobia or other reasons, they may have to go to a board-certified sleep dentist and get an oral appliance therapy made, like a mouth guard, custom made, that keeps the throat open. So going back to your original question, should they keep using CPAP? And the answer is absolutely critical that they keep using CPAP. My only suggestion to the audience is to consider sleeping in different room while you're using CPAP. Because we know that right now it's so uncertain to figure out who may have COVID-19 infection or not. We know there could be pre-symptomatic or asymptomatic carriers as well. So just out of abundance of caution, just in case someone has coronavirus infection but they don't know it yet, and they're using CPAP, the air released out through the CPAP can cause the aerosolization of the virus within the bedroom. That's why, even though it's less likely, the recommendation right now is for CPAP users to have their own separate bedroom for the time being.
Yeah, makes sense.
I learned something. Yeah.
Yeah, okay. Well, for both of you, and you've mentioned a lot of habits that would contribute to better sleep in general. If you don't have any particular disorder, symptoms, anything, what do you tell people who are just saying, I'm not sleeping as well? And personally, among my circle of acquaintances, people tend to say, well, as I'm getting older, I'm not sleeping as well. And perhaps they're just thinking, well, they don't realize they have sleep apnea. They just think the disorder is because they're getting older. So what is it that we should be mindful of? I know you've mentioned a few things, but maybe specifically for that.
Yeah, I think, Maureen, you bring up a good point. There is a link between aging and sleep. We all know that.
Do it.
Right? So we know that women, especially as they age, tend to have a higher risk of having insomnia. Because let's face it, women are the CEO of the household. They are constantly thinking. They are thinking about 5 different things. Whereas us men, one track and we go to sleep. I'm just kidding. But my point is that there are certainly risk factors associated with certain habits and behaviors that we can control. So to simplify, I think for better sleep, what I would suggest is to limit the screen time. Number 1, limit the sitting time, because we know exercise in the daytime consolidates the sleep quality and improves the sleep duration as well. So that's the second S. I would certainly recommend we avoid shots and spirits. That's the third S, right? Because alcohol disrupts sleep, worsens sleep apnea. We've been there, done that. Smoking is a big no-no as well. There's a strong link between smoking and sleep disruption.
Oh.
Yeah, so that's another big recommendation to avoid those. Um, Stress management. We cannot change the environment or the situation, but we can certainly change our response to it. So in my clinical practice, I tend not to prescribe sleep aids. My go-to is the free Veterans Affairs app called CBTI, and Dr. Shah is the expert in that. Cognitive Behavioral Therapy for Insomnia, CBTI. It's a free app available for download both in the Apple App Store, and also for Android in the Google Play. Highly recommended for people who are just unable to switch their brains off. There are other exercises that our mental health experts, such as Dr. Shah, and they recommend, such as progressive muscle relaxation, sleep restriction, meaning only go to bedroom when you're ready to go to sleep. And when I trained in New York with Art Spielman at Cornell, he reminded me of one simple maxim. He said, tell your patients, bedroom is only for two things, sleep and sex. No TV, no reading books, no pets on the bed. Let's face it, the pets take over the bed. First, they take up your bed, and they take up your heart. But sleep can be disrupted by the pets as well, especially if you have 2 or 3 little pets on your bed.
So most people have a TV in their bedrooms too, right?
Yeah, many people have the TV on the whole night as a background noise and light as well. As we take sleep history, we uncover people's sleep behavior. I would recommend not to have a large digital clock in the bedroom.
Okay.
Because what happens is we all wake up once or twice. But if we focus on the digital clock and its bright light that says 1 a.m., our visceral response to that is, see, I knew I would be up early. Now I'm not going to be able to fall asleep. And it perpetuates that cycle. So to extinguish that stimulus, no clocks, no alarms, no phone in the bedside.
Huh. Interesting. Dr. Shah, I love your comments on that too. And and Dr. Vora has also mentioned sleep aids. How should we be thinking about those these days?
Sure. Good question. And I think Dr. Vora said so well about the sleep hygiene aspects, and I think he covered all of the recommendations that we generally have for all patients with sleep problems. I'll just add one thing is, I think it's also advisable for patients to have a wake-up time, So if you have a wake-up time, whether it's 7 o'clock, 8 o'clock, or whatever that may be, trying to adhere to that wake-up time is very helpful. So what you're trying to do is to push your sleep during the night time when you're actually trying to sleep. And if you are one of the napper, and if you try to take naps during daytime, then limit your nap to maybe one nap for no more than 30 minutes, So that would also be very helpful for managing your sleep hygiene. And also, Dr. Vora also very well said about the CBTI, which is also very useful for non-pharmacological interventions when it comes to sleeping. Now, Maureen, your question was along the line of medications and if the medications are addicting, or how do we go about taking them? And that's a good question, and we get asked all the time by patients. And I think sleeping medication can be addicting if not used appropriately as advised by your provider. Moreover, if you have a predisposing factors, such as if you have a pre-existing addiction issues, biological risk factors, chronic alcohol use related problems, then certain medications can be problematic to you. And I think our general recommendation to all our listeners and our patients are, try to do that sleep hygiene first. If that doesn't work, try something over the counter like Unisom or Benadryl or melatonin, that works for some of the patients, and those are over the counter. If that doesn't work sometime, one other important considerations to make, if you have a pre-existing psychiatric problem like depression, post-traumatic stress disorder, generalized anxiety disorder, then it is very critical that you watch your sleep like hawk. It is even more important that if you have a bipolar disorder, that you really watch out for your sleep. So, and those instances, I think you have to weigh between risk and benefit of taking medications or not, And I believe that if you have a serious pre-existing psychiatric problems, you should take medications if that's what it takes to get you a good night's sleep, And you can try medications such as trazodone, mirtazapine, or Remeron, or you can try low-dose quetiapine if nothing else works, as a first line of treatment. And then once again, if this is the kind of issues when the sleep issues are chronic, treatment resistant, I think it's great to be in contact with your providers and listen to what their recommendations are. But managing 6 to 8 hours of sleep is very key in patients with pre-existing psychiatric disorder and substance abuse problems, because all what we want is not to relapse through the COVID-19 or any other psychosocial stressor you have when you are not sleeping.
Okay. Great. Well, we just have a few minutes left. I'm so glad we've been able to talk about these things. You give me so much to think about, I'm not going to be able to sleep. What would you say? I feel parents are very concerned. The kids are out of their usual routine. They're staying home. They're likely to be interrupting their usual physical routines. Any special pointers for parents of school-aged children?
Well, I'll take this question, and maybe Dr. Vora can add few more insight into it. I think we are in an unprecedented situation where our structure is kind of lost. We are looking at new beginning. We are looking at new norms, new normals. Our children are at home doing homeschooling. They also have a limited social context at this time. My recommendation to patients and the families to try to look at the structure, a routine, where you wake up certain times. If your children have homeschooling or online schooling through one of the video audio apps, then you have that schedule set up. You frequently talk to your children about their fear, their concerns, their worries. Let them talk to you, let them express them, what they're really worried about, and try to listen to what they have to say, reassure them. One of my favorite advice through the COVID-19 pandemic to all the families is limit your news watching. Watch your news no more than maybe half an hour, and then also look at only to the resources which are credible, like Center for Disease Control, your local county, or some of the other known government or evidence-based resources for informations. Sometimes information overload and also misinformations are also problematic. So those are some of the basic informations that I have for the families and the children. And then I think the most important part, if you have a pre-existing psychiatric issues, or your children have pre-existing psychiatric issues for which they have been receiving any care, then the important part is to stay in contact with your provider and have an ongoing treatment for them. And maybe Setu, if you want to add, and I know you have small kids too, like us, so maybe to your perspective.
No, those are all wonderful points. And, just from looking at the huge disruption in everyone's schedule, it is hard to maintain a semblance of normalcy, right? To have a structure. And one thing we perhaps ought to do is to perhaps be kinder to ourselves and also to the kids, and not hold ourselves to impossibly high standards. At the same time, have a rhythm, as Dr. Shah mentioned. We all have a certain inherent tendency. There are some night owls, and then there are morning larks. We know that. Teenagers, based on their biological, chronological age, they have delayed sleep phase, meaning their preferred time to go to bed is late, and they would love to wake up late. That's their natural biological circadian tendency. Now, most teenagers are able to overcome that and show up at high school at really early, ungodly hours. The society has designed that and made them suffer and almost set them up for failure sometimes in many cases. But having said that, you will notice that during the pandemic, when there is no structure of the school, kids will start to sleep late and wake up late. And as long as it's not really drastic, perhaps 1 hour delay is okay. But if it's more than that, once we go back to a routine at some point, which I'm hopeful we will, it'll be really difficult to reprogram the circadian rhythm back to what the school and societal requirements are from school's perspective or job. So the more closer to our regular routine we stay, the better it is.
Thank you. I'm just wondering, Dr. Vora, if you would recite those 5 S's again. Just tell us the words they stand for.
So, screen time, less.
Time, okay.
Right? Less spirits and shots.
Spirits, okay.
Less sitting and more walking, more exercise. No smoking.
Smoking. And
then stress management.
Okay, thank you.
Very well said.
All right. So we can wrap up here with any personal perspective that you might like to share, just as people who want to help other people in general, to view a way to view this whole crisis, a way that you're maybe using to get through it.
I think looking at it from a historical perspective and a long view, to realize that we are in the middle of a truly momentous occasion in the history of humankind, right? At the same scale as the 1918 influenza pandemic, or World War I, or World War II, the Great Depression. It's that momentous of an event that has impacted every single one of us throughout the US and throughout the world at the same time. It's unprecedented, as the word goes. So how may we reconnect back to the ancient wisdom and at the same time leverage the modern medicine so that we will come out of this stronger, better, kinder, and prepare our personal lives, our family lives, our businesses to be more resilient. So I'm extremely hopeful that we will go through the pain. There's undescribable loss as well. But in the end, just like everything does, we will come out of this and we'll come out better and stronger.
That's an uplifting way to view it. Yeah. Dr. Shah, any last words from you?
Right, and Maureen, these are very difficult time for the global communities, and it is an unprecedented time for all of us. And during this time, I remind to myself on a daily basis that this crisis makes us all feel helpless, vulnerable, and take us to the thinking of worrying about unknown or issues for which we don't have any control over. There is a feeling that we have no control about how things are going to be behaving in the future. And all I can do at this time is to recognize those fear, those vulnerability, and have a realistic perspective about how I put this anxiety into an appropriate context. I think Setu told a very, very good thing just a little while ago, and is to be kinder to ourselves, to be unforgiving to ourselves, and not having that high bar of expectations from us, from other people during this time would be very, very important, and that always gets me through the difficult time. I also remind myself that in Sonoma County we had big fires, and we have surpassed this crisis, and we have come out very strong. All these new constructions, these new buildings, new offices, the homes that I see building, that just gives me the air of the fresh beginning that we had in our county after a catastrophic fire that we had in 2017. I also schedule with myself about 15 minutes of time daily to just kind of check into myself and see like what's in my control, what's there not in my control, and then I try to make a list of things that I want to accomplish to remain in presence in that day, in that week, and try to sort of uncheck what I could do, and that is probably making me for more accomplished for the day or a week. So that is how I get through this difficult time.
That's great. Thank you. That is so helpful, and I feel quite enlightened. This bi-coastal podcast that you brought your expertise together. Dr. Shah is psychiatrist and clinical director, and Dr. Setu as internist, public health expert, and sleep expert. We so appreciate getting the chance to hear what you have to say, and in such a clear and understandable way. That is a real treat. So thank you both, doctors. It's been great chatting with you.
A pleasure, and we wish you and your listeners and patients the very best. Stay healthy, stay home.
I say the same, stay healthy and stay home. And Setu, once again, thank you for accepting my invitation and being here on the podcast today. Okay.
My pleasure. Thank you again.
Okay.
Take care.
Yes. Bye-bye.